Hi, today I'm going to be talking about asthma and public health and how it affects and how it relates to each other. Number one, public health problem. Why does this problem exist in the society? WHO estimated that about 235 million people are suffering from asthma. 1 in 12 people are the equivalent to 25 million people in the United States have asthma. Asthma also costs the United States about $56 million just in medical costs, lost school and work days, and early deaths in the year 2007. Also, asthma is a lifelong disease and there is no cure. Asthma rates are only increasing each year and it can limit a person's quality of life. How did this happen? The causes of asthma is still not completely understood, but there are a lot of risk factors that do contribute to this disease, such as genetic predisposition with environmental exposure to certain inhaled substances, such as air pollution, tobacco smoke, indoor or outdoor allergens, and chemical irritants. These are just a few factors that do contribute to asthma. Also, asthma can be developed later on in life as well. It's not something that you're just born with or just in your genetics. Where did this happen? Asthma occurs everywhere, all across the world. There is no specific place where asthma happens and where asthma is developed. Definitely, environments that have more air pollutions and allergens will trigger or worsen or even increase the chance of developing asthma. What are the risks for the community in the future? Out of the 22 million affected in the United States, 6 million are children. That means 1 in 10 children in the United States have asthma. The number of people with asthma continues to grow each year, and there is no trend that is showing that asthma is going down. In 2007, 7%, which is 20 million people, have asthma, and in 2009, 8%, which is 25 million people in the United States, have asthma. What are or were the etiological factors? According to this graph on the right, it clearly states that more women are affected by asthma than men. More children are also more prone to getting asthma than adults. And low and lower middle income areas or countries have a higher rate of asthma-related deaths. Strategy 1. There is no cure to asthma, but there are medications and treatments that can help control the disease. So this is just one strategy of how to solve the public health problem. And for the second strategy, it is to implement better asthma education so that people can prevent asthma attacks. Also, so that people will know what to avoid that can trigger asthma. If we provide these strategies or even these programs and educations and outreach programs, people will be more likely to understand the disease and to prevent it from happening. Here I provide 2 cultural examples of how we can help continue to solve this problem. Choose where you live so that you can breathe clean and fresh air with the least air pollution. There are many cities in the United States that are ranked really well for people with asthma to live in. San Francisco is the #1 city that has an asthma task force to help prevent asthma, to reduce asthma disparities, and to improve the quality of life for people with asthma who live or work here. Another cultural example is in California, there are several cities that provides asthma programs. By offering and reaching out to people with asthma, there are less deaths and sudden visits to the ER due to asthma attacks. Public health in the future. What should be done to prevent the reoccurrence of the problem? There should be more money and research done about asthma. As of right now, there are not a lot of programs that are dedicated to funding and to understanding asthma. Also, more research should be done to see if there are more long-lasting medications or treatments that can prevent asthma attacks. And last but not least, better education and outreach programs should be implemented and funded by the government so that people that cannot afford to be in these programs can go to these programs and then they can understand more and more about asthma and how to prevent it from happening. My opinion, there should be more studies and research on places where people with asthma should live in, and not only should there be outreach programs for adults, there should also be programs that are suitable for young children with asthma to help them understand what to do or not to do. Because since such a large population of people that are affected by asthma are young children, there should be programs implemented and directed towards that age group just to make sure that they don't know what to do and what to do. And here are my references. Thank you so much for listening and have a good day.